The TOX tissue oximeter is an optically based device that assesses tissue viability with StO2. The ViOptix TOX tissue oximeter is intended to non-invasively estimate the percent oxygen saturation, StO2, in a volume of tissue. The TOX is indicated for use in monitoring patients during circulatory or perfusion examinations of skeletal muscle, or when there is a suspicion of compromised circulation. It measures tissue oxygen saturation in a volume of tissue underneath the sensor. Main applications for the TOX are breast reconstruction and free tissue transfer procedures. Make sure the power cord is firmly connected in the rear of the console. The power switch located on the back side should be in the up position towards the 1. The backup battery in the monitor lasts approximately 30 minutes and is designed for transport use only. The console should be plugged in at all times while in use. To turn on the monitor, press the blue on button located on the front of the machine. The LED indicator will flash slowly while the system is booting on and performing self-diagnostics. Startup time is about 1 minute long. When the system is ready for use, you will see a screen with 6 menu buttons across the top. At this time, the ViOptix sensor is ready to be attached to begin patient monitoring. The standard console configuration is a 2-channel option, Channel 1 and Channel 2, which can be used individually or at the same time. When connecting the sensor, notice the green arrow at the base of the connector and the sensor head. These arrows should be lined up when connecting the sensor. Once you have lined up the green arrows and felt the sensor insertion, simply turn the knob to tighten the connector. Turn the sensor to a snug fit. If the green arrow marks are not properly lined up, sensor damage is likely to occur. Now that the sensor has been connected, the monitoring screen will appear. You are now ready to begin patient monitoring. To begin the monitoring process, make sure the metal sensor head is firmly attached on the cleaned and unobstructed area of the skin. That will ensure a good contact for tissue monitoring. Once the sensor is attached and ready, press the red square button to begin monitoring. Notice the red square has become a green arrow. This indicates the monitor is recording. Each sensor requires a few moments to adjust to the light level as indicated at the sampling status shown in the message line on the bottom of the screen. When the sensor is done calibrating, a signal quality number will appear. This number is an indicator to guide you in positioning the sensor for reliable StO2 readings. Remember, the ideal range for signal quality is above 80. When signal quality reaches a satisfactory range, the current real-time reading of tissue oxygen saturation percentage, StO2, will display. This data is also displayed in a trend graph format, which indicates where the readings fall with regard to the lower alarm settings. Keep in mind, ViOptix measures oxygen locally and continuously, which will provide a different number than a pulse oximeter. When applying the second sensor, notice the change to the user interface. A second red square appears, so each channel will be able to start and stop independent of one another. Notice the screen is now split, giving the users 2 trend lines, signal quality readings, and StO2 percentages. It is recommended to monitor the patient for at least 48 hours post-operatively. During this time, there are 2 recommended parameters that are preset in the TOX monitor. The alarm will be triggered when the StO2 drops lower than the alarm line at 30% or has a drop rate of 20 points per hour. Alarm levels and drop rate settings can be changed in this menu and can be set differently at each channel if preferred. Remember, these are just the system defaults. Please refer to the surgeon instructions or hospital protocols. The channel-specific StO2 data can be reviewed in greater detail by tapping the Review StO2 button on the main screen. A graph is displayed from the previously sampled data. Using the Navigate Graph buttons, you can find a specific time period for review in the StO2 history. The Review Data button will display the current graph data in numerical table format. To go back to the monitoring screen, simply tap the main button. While reviewing the data, it is possible to zoom in to see a specific section of the data, or zoom out to see the complete trend. Use the up and down arrows located on the right side of the screen to adjust to the wanted view. This example shows a flap with no complications, as indicated by the flat trend line. Push the green play button to pause data collection. Tapping the Stop Recording button will display the Oops, Save, Discard screen if any patient data has been acquired. This screen gives you the option to oops, continue recording, the option to discard data, or the option to save the data. Once the data is saved or discarded, the temporary data file is closed. When you save the data, the file will be permanently saved to the console. To turn the unit off, hold the on button in, then release it after 3 seconds. The console will perform a shutdown sequence and power off. To remove the ViOptix sensor, turn the knob counterclockwise. Make sure you do not pull or sensor damage will occur. When you are done using the ViOptix machine, please be sure to dispose of the used sensors. When finished, please be sure to return the monitor to the operating room. When under low signal quality conditions, the STO2 display will be replaced by 2 red dashes and the alarm will indicate a poor skin contact between the sensors and the designated skin area. To stop the alarm, simply pause the monitor by tapping the green play button, then clean the sensor with alcohol wipes and make sure the monitoring skin area is clean and dry. Reapply the sensor with Tegaderm at the same spot and resume the monitor by tapping the red square button. The TOX machine will then start to monitor again. It should be noted that while reapplying the sensor, it should be placed in the same direction and orientation as it was before, otherwise a different reading may occur. If there is any unsaved data while attempting to turn off the console, the oops screen will appear. At this point, you may choose to save or discard the data in order to turn off the console. As mentioned earlier, the rocker switch should always be in the up position towards the 1. It is recommended to keep the rocker switch up at all times, even when not in use. As mentioned previously, the battery has a 30-minute runtime and is meant for transport use only. If the battery does become fully depleted, it will take 3 hours to charge the battery back to full. In-service information can also be found under the Help button on the main screen. Each TOX monitor comes with a quick reference guide explaining powering on and off, basic operation, normal STO2 range, and troubleshooting information. If there are any further questions, please contact your regional manager for more information. Your rep's contact information can be found on the monitor, as well as the back of the guide card.